No, I can't let you go without this one. Antibiotics. He was saying today that we don't need antibiotics. Now, that we don't need them at our clinic because of the way we handle it. How is it that you handle problems when it seems like antibiotics are used constantly? And everybody knows that they're a problem because there's antibiotic resistance and so forth, and they claim the strain of the bug is getting worse and all these other things, and yet it's a tool that's used by orthodox medicine constantly, and yet you say we do not need this.
No, we don't let the patients suffer, but in our clinic, even though we have so many children with ear infections, with lung, we have adults with bladder infections, with diverticulitis, with lung infections, and so on and so on. But we do not need, because we do an intensive change of the inner milieu. We fortify day one our immune system instead of suppressing. You are not sick because of the bacteria. You are sick because your immune system can't work out these changed bacteria. This is the real key. So we do not need antibiotics.
So the germs don't cause the disease. The system itself is a diseased system, and that allows the germs to proliferate grow. And then because of their toxic byproduct, then they make the system more toxic.
Yeah, it's a zigzag, of course. I couldn't say the bacteria doesn't make anything. No, but it's only can make something bad because it has its milieu to grow.
It's got the opportunity. It's like a swamp.
Yeah.
And the mosquitoes breed in the swamp. But if you drain the swamp or clean the swamp, then there's no mosquitoes. They go away. No need.
Yes, they go automatically. They just disappear.
Yes. Or the other example of the flies don't cause garbage. But if you have garbage, the flies are there. As soon as the garbage is clean, no more flies.
Yes.
So the bad bugs, are only there for a reason. They're there to clean up the mess. They feed on it. But if you clean up the swamp, clean up what's on the inside, now all of a sudden they go away. And then there's no more symptoms, because that's all it is. It's just symptoms.
Yes. So. And I must say, these treatments, they work even on very sick patients like multiple sclerosis, like lung fibrosis, like ulcerative colitis or Crohn's disease and rheumatoid arthritis. These are the patients who come to us, and after a certain time they get continuously better and they heal out of their disease, because we increase the healing capacity of the body instead of suppressing any reaction.
Totally, just a completely different approach, a different paradigm. And once you understand the paradigm, it'll change your life. It'll change the way you view illness. It'll change the way you live, and because you understand why you need to eat healthy, how it is a benefit to your body. You know, one other thing too, because
I have to say something for the doctors who listen now. Look, the bad thing of biological medicine is that you lose your patients, but you lose them because they get healthy, and each patient you lose brings you at least 10 others. That's why we still...
The business never... it's actually a growth industry.
Yes, it's a growth industry. Look at our clinic, how big it is. We are the biggest clinic in far around. And
I understand you're going to expand as well, which is even... I'm so glad to hear that.
Yes.
It's just success. That's what that is.
Yes.
Before you go, I wanted to mention too, and you brought it up today, tinnitus. Huge, monster problem. Lots of people have this ringing in the ear. How does biological medicine approach to solve this problem? And have you had people that have had terrible ringing that have lost it?
Yes.
It's gone away?
Yes. Yes. Tinnitus is difficult to treat. One of the most difficult diseases to treat for me is Parkinson's, I must say, yes. But tinnitus, it gets quite, most patients get much better. I wouldn't say fully good, but much, much better, so that they can lead a normal life, or they no more realize the tinnitus, or only several times and so. But what are we doing? Detoxification, and we look strictly for electromagnetic load, because electromagnetic influences can have a real impact to the tinnitus. And people who always phone with the mobile phones, which is very bad for tinnitus, or also the electricity which comes from the television, you know, electromagnetic load is very important. But again, detoxification and upbuilding thing, we feed your nerve cells so that they don't reclaim, that they are no more so hypersensitive. We give them vitamin B, carnitine, taurine, phosphatidylcholine, other substances which feed the nerve cells so that they get healthier and they have more tolerance.
And you mentioned cranial-sacral adjustments so that there's a flow of blood to your...
Very often, yes.
So that's part of the therapy that's used?
Yes, one part.
One part. Well, again, thank you for your time, and thank you for sharing your wisdom and knowledge about our bodies and the marvelous, the way they were created, which is self-repairing.
Yes.
That is the most amazing part about it, is that our bodies have a wisdom to know how to repair itself. And what I really appreciate about biological medicine is that it's working with the body to help it repair itself and to clean it out and to encourage it and to nourish it. Those are the things that make sense to me, whereas suppressing symptoms never did make any sense, because I always knew there was never an end to the symptom suppression. And the side effects of the drugs many times were the exact thing that we were trying to avoid. You try to avoid having diarrhea, one of the side effects of the drugs was diarrhea. You know, so crazy. But again, thank you so much, and we appreciate your time.
Very welcome. Bye-bye.
Bye-bye.